Over the past several weeks, I've been going over some of the studies that have been conducted through the University of Minnesota Rural Health Research Center. Today I'll be talking about the policy brief titled Key Informant Perspectives on Supporting Health and Well-Being for LGBTQ+ Rural Residents. In this study, the authors interviewed representatives from various national LGBTQ+ support and advocacy organizations about the health and well-being of LGBTQ+ folks living in rural areas. They asked these representatives two open-ended questions. One, what do you see as the biggest challenges to supporting the mental and physical health needs of LGBTQ+ folks in rural communities? And two, what are examples of policy changes that you think would improve the ability to meet the mental and physical health needs of LGBTQ folks in rural communities? With respect to the challenges faced by LGBTQ+ folks in rural communities, the most common themes by respondents were lack of resources and lack of cultural competency. Addressing the lack of resources, such as broadband, transportation, and housing, one respondent noted, "There are just fewer resources available to rural areas. When we think about being a minority within an already underserved rural area, it compounds barriers that people experience." Addressing the lack of cultural competency, such as healthcare providers who are not LGBTQ+ affirming or don't have current information on treating LGBTQ+ patients, one respondent stated, "If there is discrimination or lack of cultural competency at the doctor, there may be no alternative in town. Discrimination is not uniquely rural, but when it happens in a rural area, the impact is much more profound." Policy recommendations by the respondents to address these challenges included non-discrimination protections. One respondent stated, "Religious exemptions in healthcare are especially difficult, allowing people to exclude themselves from non-discrimination laws." Another policy recommendation was education, to train providers on the best practices when caring for LGBTQ+ individuals. Quoting one respondent, "The most important thing is to make sure everybody who is coming out of medical school and therapist training is prepared to work with LGBTQ folks. So when they end up in small towns, they know what to do." If you'd like to read more on this study, you can click on the link below. For more articles like this, visit the University of Minnesota Rural Health Research Center website. Also, let us know in the comments of any health topics that you'd like us to address.